The birth of a baby with cleft lip or cleft palate is a shock to most families. Many parents have never seen or even heard about this physical deformity. Consequently, many parents have concern about what can be done about the future of their child. We will briefly try to answer some questions and lessen the parents' concern. Now that you are on board Smile Train, do not worry because you have come to the right place. Be patient and listen carefully to all the advice the doctor gives you. Your child can be absolutely normal, but for that, you have to pay heed to what the doctor advises you and follow the plan of treatment. The nature of cleft lip and cleft palate. A cleft is a separation of the parts of the lip or roof of the mouth which usually come together during the early weeks in the development of an unborn child. A cleft lip is a separation of the two sides of the lip and often includes the bones of the upper jaw and the upper gum. It looks as though there is a split in the lip and the upper gum. The palate is the roof of the mouth and the front part contains bone that is hard and the back part is the soft palate. A cleft palate is when these two sides have not fused together during the development of the child. Cleft palates can vary in extent. An incomplete cleft palate involves just the back of the soft palate, while the complete cleft palate extends the length of the palate to just behind the gums. Because the lip and the palate develop separately, it is possible for a child to have only a cleft lip, only a cleft palate, or both of in various degrees like unilateral incomplete, unilateral complete, bilateral incomplete, bilateral complete. Causes and frequency. Cleft lip or cleft palate does not occur because there is a defect with the mother or because of eclipse or for any other superstitious reason. While there are many possible causes being investigated through research, no single cause has been identified till today. What we do know is that majority of the clefts appear due to a combination of factors, genes interacting with certain environmental factors. There could be other reasons like poor maternal health, vitamin deficiency, high fever during early pregnancy, medication or infection. The chances of cleft baby can be reduced by giving folic acid supplements in early pregnancy or before conception. Feeding problems. Like any other growing infant, the infant born with cleft lip or palate needs to have proper nutrition. So feeding the infant becomes very important. As these children have no partition between the nose and the palate, they cannot suck or swallow easily. They have to be fed little at a time. Breastfeeding should be tried for all children. If they are having difficulty breastfeeding, extract the breast milk with the help of a breast pump and feed the child with a shang, palade or bottle. Remember to keep the child in an upright position while feeding. It may appear that the child's stomach is full, but this is because the child will invariably swallow a lot of air along with the milk, so burp the child frequently as it is necessary to bring out swallowed air at least 3 to 4 times during the feeding and once after the feeding. Sometimes liquid may come out through the nose. One should not worry too much as this can be reduced by putting the child in an upright position. Solid feeds should be started once the child reaches 6 months of age, like any normal baby, even in the presence of cleft palate. Monitor the child's weight as he has to gain weight like any other normal child. If he is not gaining enough weight, contact your doctor. Plan of treatment. The objective of surgery on the lip is to close the cleft so that the appearance is natural and the face develops normally with minimal scarring. The goal of the palate surgery is to close the cleft so that the palate can function normally during eating, drinking, and speaking. The cleft lip is ideally operated between the ages of 3 to 6 months when the child's weight reaches 5 kilos and hemoglobin or blood level is 10 grams. The cleft palate is operated at the age of 12 to 18 months. Preparations before the surgery. 1. Child with parents or guardian should get admitted 1 day before surgery and come to the hospital at 8 a.m. 2. The child should be bathed properly with hair wash on previous day. Cleaning of nose, ear and nails is necessary. 3. Child should be starved as advised by the anesthetist. 5 hours starving is necessary for a child. Remember, if you have fed the child and not informed the doctor, this could be very dangerous, as during the operation, the child's life could be at risk. Therefore, it is necessary to keep the child starving. The surgery. The child is taken to the operation theatre by the anesthetist, who anesthetizes the child. Then the child's hands are plastered so that after the surgery, the child's hands are restricted, preventing him or her from touching the sutures. The surgeon then measures and marks the areas where the incisions will be made, after which the surgery for the repair of the cleft lip begins. It takes about 2 hours for the cleft lip surgery. Similar procedures are carried for the repair of the cleft palate. It takes about 1.5 hours for the palate surgery. Post-surgery care. 1. After the operation is over, the mother will be called to comfort the child. There may be blood coming out from the nose or mouth, which will stop in a few hours. 2. Water, coconut water or any other liquid is given after the child is fully awake. Child operated for the cleft lip can be given breast feed or bottle feed or solid food on the same day. Children operated for cleft palate can have only liquid diet for 7 days. After 7 days, soft diet can be given for 2 more weeks and normal diet after 3 weeks. 3. The child operated for cleft lip will have the suture removed after the 5th day. 4. The child operated for cleft palate does not need any suture removal. 5. After the lip operation, the face should be washed and cleaned daily. The scar massage should be started after 2 weeks of surgery and will have to be continued for 6 months. This would ensure better results for lip repair. After the surgery, the care continues. Between the ages of 1 to 3 years, repeated ear checks by an ENT surgeon is necessary, as these children are more prone to middle ear fluid collection and ear infection if neglected. This may impair hearing, which will affect the speech development. Between 2 to 4 years, speech development is very important. If there is a problem of the child speaking through his nose or not producing any sound at all, then he needs to be taken to a speech therapist. If by 4 years of age, the child's speech is not proper, he may need another surgery. It is advisable to put the child in school by the age of 3 so as to help him stimulate to speak. Children who have been operated after 2 years of age for the cleft palate have many speech problems and they would need 6 to 12 months of speech therapy. This can be done at the speech therapy department. It is also very important to brush regularly and keep the teeth healthy. Brush twice daily to maintain oral hygiene. It is very essential to keep regular dental checks to preserve all the teeth in proper health, because these children are likely to have less teeth. Most of the children who have a defect in the gum bone or jaw bone will need some orthodontic treatment by using dental clips and wires starting from age of 6 years. Those children who have a defect in the gum may need one operation at the age of 7 to 9 years to fill this defect. Some patients at the age of 16 to 18 years may need one operation to finally correct nose shape. This operation is called rhinoplasty. Some of these children will have defect of a flat face, and this can be improved by major operation after puberty. Remember, the earlier you begin the treatment of your child, the easier you make their future. Now you know that you can give your child a perfect face and a smiling future.